Hi everybody! Today is April 8th and I'm making a video about Ampyra today. But before I get started, I first have to say thank you to Brian Legree because you mentioned that my video, like when my head moves up and down or left and right, the camera moves with me, and I had to read the manual and make an adjustment on my camera. So Brian, thank you for pointing that out. And also thank you for subscribing to my videos because your brother Anthony does not subscribe, so thank you. And I also would like to thank Phil and Rose Hamilton for writing to me because you gave me the idea to make this video. And it's really exciting information, and I thought I would share with you everything that I have learned, and hopefully I can answer some questions. But of course you can always look on the internet, which is what I did. I went on the MS Society's website and you can talk to your doctor. But I'm going to tell you information that I found. And Ampyra is formerly known as Famperdine, which I had heard originally. And it's from Acorda Therapeutics. It was approved by the U.S. Food and Drug Administration in January for its ability to improve walking in people with any type of MS. And I thought, oh my gosh, that's exciting. And then it says it is now available by prescription. And this is the first therapy specifically approved to treat a symptom of MS, and it represents a big step forward for many people who may benefit. And I just recently said in one of my videos that we have a lot to look forward to. Well, this is just one thing. It's like, oh my gosh, it's a medication that can help a symptom. It's really exciting, especially for walking. I think this is really, really exciting. And I'm sure many of you know there are several medications available to help with other things like spasticity, fatigue, or depression. But until now, there was no pharmacologic treatment available for MS-related difficulty with walking. So that's really exciting. And I had a couple questions, and so they're basic questions, but I thought I would tell you what my questions were, and I'll give you the answers that I found. And basically I wanted to know what Ampyra was exactly. I didn't know if it was an injection or infusion. I don't know what it was. So Ampyra is a tablet which may improve the conduction of nerve signals in nerve fibers whose insulating myelin coating has been damaged by MS. So if you have read about the damage to myelin sheath, that's basically what this does. It improves the conduction of the nerve fibers. So that's cool. And then the next question I have is, how is Ampyra taken? And according to a company press release, Ampyra will be taken 2 times a day, approximately 12 hours apart. So once in the morning and once at night. Next question, can anyone with MS take Ampyra? It says Ampyra was approved for persons with any type of multiple sclerosis. I thought, oh my gosh, not just relapsing remitting, that's really exciting. And it says, however, the FDA's approval of Ampyra comes with a warning that the drug should not be taken by individuals with a history of seizures or by those with moderate to severe kidney impairment. And the reason why you shouldn't take it if you have kidney impairment is because there is danger that the concentration of the drug will increase in the blood beyond the amount considered to be safe. Next question. Can a person take Ampyra along with other MS medications? According to the prescribing label, yes. Next question. Would a person take Ampyra on an as-needed basis or every day? The answer is, this drug was designed to be taken 2 times per day, about 12 hours apart, like I just said, so that amount of the drug in the bloodstream is fairly steady. For that reason, taking it on an as-need basis would probably not be helpful. Next question. What would happen if an individual stops taking Ampyra? Would walking issues get worse? And I read that question on the internet and I thought, that's just like taking a drug holiday. And I recently made a video about that. And here's the answer to this question. It says, it appears that if a patient stops taking Ampyra, their walking ability in most individuals returns rapidly to how they were before they started taking Ampyra. Some people in clinical trials of Ampyra experienced a worsening of their MS symptoms when they stopped taking the medication. The FDA determined that the risk-benefit ratio for Ampyra is satisfactory. And I read that and I thought, that's exactly why I don't want to take a drug holiday. I figure I am doing so well now that I fear that if I stopped taking my medication that I would get worse, that my MS symptoms would change or get worse. So that's why I have continued taking Tysabri. I've had my 30th infusion. I feel amazing and I don't want to make any changes. So the same goes for Ampyra. And it says, this is the last question. What are the potential side effects of Ampyra? In the first phase 3 study, common side effects experienced were back pain, dizziness, insomnia, fatigue, nausea, and bladder disorder. But I also made a video about side effects, so if you haven't seen that video, you can watch that. Everything you take, whether it's Tylenol or Ampyra, has side effects, but it doesn't mean that if you take it, you will get those side effects. Everybody's different, and we all know that. So those are just some reported side effects that some people have had. So I hope that this was helpful for anyone interested in knowing more about Ampyra. And of course, if you have more questions, you can talk to your doctor. I hope you're doing well, getting ready or enjoying the spring, depending on where you live. It's really cold here in Michigan today, but that's okay for me. I hope everybody's doing well, and I'll talk to you soon. Bye.